Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. A congenital heart defect, or CHD, is the most common birth defect in the United States, with 1 in 100 babies born with it. The defects can range from a hole in the heart to a missing heart chamber. What causes congenital heart defects, and how are they fixed? We'll answer those questions and more with Dr. Mehar Hoda, pediatric cardiologist at the WVU Medicine Golisano Children's Heart Center. Welcome, Dr. Hoda, to Live Healthy West Virginia.
Thank you, Mary. It's an honor to be here, and I'm so excited to be talking about my most favorite topic.
Well, this is a good time for it because it's National Heart Month.
Yes, absolutely, it is.
So let's talk about the children's hearts. So let's start with the basics. What exactly are congenital heart defects?
Right. So the hint lies in the name. So when we say congenital, we mean something that you're born with. So these are birth defects relating to the heart. And not only do they involve defects that are inside the heart, such as problems in valves or walls that are within the heart, but they can also involve the great vessels that come out of the heart. So it is a combination of all the things that can lead to and exit from the heart. And a lot of the times, these are associated with abnormal heart rhythms as well. And they all come hand in hand. But unlike the more commonly known heart defects where we think about heart attacks and we think about cardiomyopathies, these are not things that life does to you. These are things that you are just unfortunately born with.
So what are the most common heart defects? I mean, I saw there was a huge list. What are the most common ones that you treat?
Right. So the most common ones are what are most commonly known as holes within the heart. So these are defects in the walls that separate the right and the left side of the heart. So holes in the top chambers of the heart would be called atrial septal defects, or ASDs. And then there are holes that exist in the wall that separates the bottom two chambers. And those are ventricular septal defects, or VSDs. And then after that, we have some common valve disorders. So in children, or very young children, I would say there's something called pulmonary valve stenosis. This is the valve that opens up and allows blood to go from the heart to the lungs. Sometimes that doesn't form correctly and it can be too thick. And then sometimes you can have abnormalities in the great vessel that comes out of the heart, like the aorta. And so that is usually called a coarctation of the aorta. So these are, I would say, the more common ones that we see. These are considered our bread and butter, so to say. And these are the ones that, anybody, you don't need any special training after doing your cardiology training to be able to treat.
Okay. So what causes congenital heart defects? I mean, could it be just from being born prematurely, or are they hereditary?
Sure. And this is actually a really good question because a lot of parents actually ask me this. I also do fetal cardiology where I diagnose a lot of these defects before birth.
Oh, wow.
And so these mothers are always like, is it something that I did or didn't do? Is it a medication that I took? Is it that the fact that I didn't know I was pregnant and, I had that glass of wine when I was at that wedding? And, we always tell moms, especially moms, it is so important to get rid of that guilt that they have. And so I really want all mothers to know that there is nothing they did or didn't do that caused the heart defect. And it is not their partner's fault either. Congenital heart defects just happen. Okay, they are very common. They occur in 1 in 100 pregnancies. So if you were to look at a neighborhood and there are like 100 people or 100 houses, there would be approximately one child that is born with congenital heart disease in that singular neighborhood. And of course, the growing thought is that there is some environmental effect that affects the growing of the heart while it happens. And so every once in a while, we'll have, the odd diabetic mom whose blood sugar was not under control. And we know that high blood sugar can affect, development of the heart. Yeah. So that is one thing that I would say, is a known cause for it. Sure. And then you mentioned familial genes. So there is some connection between some genes and congenital heart defects. And then there are some exposures that historically have been associated with congenital heart defects. So a lot of them have now been debunked, and because now we know more about this, and we know that there were initially some confounders that were causing us to think that these were related, but now a lot of these, are no longer considered to be causative. So when a family comes to me and they're like, well, I had another child with a congenital heart defect and we have this uncle, some of them I'll say sometimes, every once in a while, it'll be familial. There is that one gene that's passing along in that family that's causing it. But sometimes it's not as straightforward. You can have that gene, but it doesn't automatically mean that you're going to have congenital heart defects. So it's usually a multitude of things that comes together to cause a fetus or a baby or an unborn child to have a congenital heart defect. I wish there was a more straightforward answer.
No,
unfortunately, there isn't.
I like the point you made, though. We're always mothers. We're always looking to blame ourselves. Yes. It's always my fault.
Yeah. Pregnancy is special because there's so much of a responsibility. We feel like we have this responsibility to care for this child and do everything right for this child, but some things are just not in our control.
No, and we've got to accept that.
Yes, absolutely.
So are there any symptoms we should look for a congenital heart defect, even while you're pregnant or afterward? Yeah.
So unfortunately, in pregnancy, there's nothing straightforward. You're not going to know whether your unborn child has congenital heart disease unless you undergo screening. And so some mothers are at higher risk. And so there is a protocol or a certain qualities of a pregnancy that would mean that you get referred to a fetal cardiologist to get an additional test, which is basically focused on the heart for a full hour. And so that will diagnose most of the congenital heart defects. After birth, the most common thing that leads a pediatrician to refer to cardiology is a heart murmur. Now, not all heart murmurs mean congenital heart disease, but most congenital heart diseases will have a heart murmur.
Okay.
And then other things that you can notice is cyanosis, or bluish discoloration of the skin. And this is very important to make the distinction between cyanosis that is related to congenital heart disease and cyanosis that is not related to congenital heart disease. Because cyanosis that is related to congenital heart disease is more of what we call central cyanosis, because it's bluish discoloration of the mucous membranes inside the mouth, not bluish discoloration in our fingers and toes, because that can just mean that, you're maybe under 2 and have an immature vasculature. So yes, bluish discoloration in the mouth, bluish discoloration in the finger beds.
Oh, okay.
Yeah, the nail beds.
Interesting.
Can sometimes be a clue towards congenital heart disease. And then when they're very young and they can't tell you that they're having symptoms, things to look for are difficulty feeding.
Oh.
And so classically, a lot of these children or babies, they'll drink from a bottle or they'll nurse, and then they'll separate from the bottle or the nipple to gasp for some air. Oh. It's almost like trying to drink water when you're running a marathon because they're constantly exercising, and it's hard. You need to separate your mouth from the bottle to be able to get some air. And so basically that's how these children are. They're trying their best to feed, but they need to take breaks to gasp for air. And so that's a very typical symptom.
Yeah.
And then every once in a while, when they're a little bit more grown, you'll start noticing that they have exercise intolerance. Or they'll try to run long distances, and then they'll either pass out or they'll just feel like they can't do this anymore, or they'll have chest pain. And that can be a symptom of congenital heart disease later on as well.
You mentioned earlier that you can diagnose some of these defects while, during pregnancy. Can you fix them during pregnancy? That sounds like that would be really hard.
We're really working on that as an industry.
Really?
There are some defects that we are experimenting with, I will say. They're not routine. And unfortunately, we don't have the resources or the expertise in West Virginia. These are specialized in probably 2 or 3 centers in the country. And they are the ones that have taken the lead on it. They have the expertise. And they are trying their best to catch the congenital heart disease before it gets to a point where it's going to be detrimental. and it's still a work in progress. But we're trying our best as an industry to see if there is any utility in trying to do something before the baby actually comes out. Now, if the baby does have an abnormal heart rhythm before they're born, you can treat the mother with medications, and you give her a large dose of the medication in the hopes that some of the medication crosses the placenta and goes to the baby and goes in a concentration that treats the baby's heart rhythm.
Oh, okay.
And so we monitor then both the mom and the baby, because you're giving the mom a very high dose and she doesn't quite need it because she doesn't have an abnormal heart rhythm.
Yeah.
And then you monitor the baby to make sure that you are actually treating the abnormal rhythm.
Oh, okay.
So we're making some headway, but unfortunately, definitive repair has to occur once the baby is born.
Okay. So in general, once the baby is born and you discover a CHD, how do you treat them usually?
Sure. And so depending on what kind of CHD it is, some CHD is in a category where you can follow them outpatient. You know, you have a discussion with the family, you tell them what you see, you tell them what this means in the short term and the long term. And then if the baby is in a position where you can send them home, you send them home. But you always set up follow-up before you send them home to make sure they're going to come back. Every once in a while, you start some medications that help delay the need for a surgery, but some defects will require definitive surgery. Some of these defects will close by themselves. If, for example, you have a hole that's small or maybe even moderate, eventually the wall grows and approximates and the hole is gone.
That fascinates me because a hole in the heart, that sounds like terrible.
It does, right?
And you can just wait for it to heal on its own.
Yeah. It's pretty fascinating how sometimes the body just takes care of itself.
Wow.
And in others, we just have to support the body and we watch it. We can start medications. If the medication works, we can delay it to a point where the baby is bigger. The surgeon always says bigger is better.
Yeah.
And so the larger the baby is or the child is, the easier it is for the surgeon to actually do their procedure. The shorter their recovery period is, the lesser the complications are. And so we try to get them to be as large as possible. Every once in a while, we get beaten by congenital heart disease, and we have to take them in earlier.
Yeah.
But at that point, you know, we count our blessings. We're like, we have a child, we have an anomaly that we can fix, and we're just going to go, and we're going to do it.
What do you have to do differently, though? I mean, they're just tiny little hearts. I mean, that would be so intimidating.
It is pretty intimidating. I have to say, you know, these surgeons, they're amazing people. They to be able to look at a heart that is so incredibly tiny and make these changes to make it not just compatible with life, but also have a good result that is durable and lasts for, you know, the duration of their entire life. Because a lot of these surgeries are one and done. You repair it in the first year of life, and they don't need any other surgery for the rest of their lives.
Wow.
And then, unfortunately, there are some that will require some surgeries later on as well. But I will say I'm in awe of these surgeons. These kids are tiny, and their limit is just 2.5 kilos, which is still a very tiny child.
Yeah. Yes, it is.
And they have such such good finesse with their, with their skill set. I have to say, a lot of the times you go into the OR to check what the result is after surgery, and the heart looks like it never had a defect.
Wow.
And so yes, absolutely. I mean, these surgeons, we are blessed with, you know, these amazing, skillful surgeons that do such a good job at repairing congenital heart disease.
And I imagine there's been some great advances in treatment for congenital heart defects.
Yeah, I mean, several decades ago, if your baby was diagnosed with hypoplastic left heart syndrome, where the left side of the heart is underdeveloped, and you can argue that is probably the most important part of the heart because it pumps to the entire body, your child would be put on a transplant list because there was nothing that we could do.
Wow.
And now, over time, over the past several decades, we have not only created a surgery that can help reroute blood so that circulation is compatible with life, but we have also perfected that surgery. And now we have several surgeons across the country that can do it. And now, very rarely do these children actually need a heart transplant coming out of the womb.
Wow.
Right. So,
Wow.
so yes, definitely. Advances are constantly happening. We're constantly pushing limits. And these surgeons are doing such a great job.
That's good to know. That's good to know.
Mm-hmm.
Is there anything we can do to prevent CHDs, whether it's mom or, the child after they're born, something we should do to prevent?
Right.
Wishful thinking, right?
I know. I mean, the only thing I can think of is that if you're diabetic, just be on top of your blood sugars. Sometimes, unfortunately, mothers don't even know that they're diabetic until a little bit later in the pregnancy.
Yeah.
So in that case, yes, you have no control.
Right.
But if you do know, if you're a known diabetic, then I will say that if you are trying to conceive and have a baby, stay on top of your blood sugar control. And after birth, unfortunately, there's not much to do because, the heart's been formed. The heart is formed before you even know you're pregnant a lot of the times. And so a lot of these defects are already underway and have manifested by the time you know that you're pregnant. That's why it's so important to be in excellent shape while you're trying to conceive.
Okay. I'm going to ask you 2 questions I bet that you get a lot from parents, because I'm just thinking if you get, oh my gosh, you find out that your child has a congenital heart defect. Can my child live a long, healthy life with a CHD?
Yeah. That's actually one of the very commonly asked questions. So you hit that right on the head. It really depends all on what kind of CHD it is. So if it's a simple hole that we discovered and it's been patched and you're basically now like a completely normal heart. Your heart functions just like a regular heart. You probably will still need to follow up with a cardiologist for the rest of your life because, it's had surgery.
Sure.
But you should be able to live a long, healthy life. You can play sports, you can have kids, and you shouldn't really feel any different, other than the fact that you have a scar down the center of your chest.
That was my second question that I thought you would get a lot. Can my child play sports?
Yeah. A lot of families are actually very concerned about that.
I know.
Especially the fathers that are very much into sports. They're like, this is going to, I was going to, teach this kid how to play baseball. And so are you sure that, can I still have this dream of, teaching this kid how to play baseball or football? And the answer to that also, depending on the type of congenital heart disease, and most of the time it's yes. Most of the time it's yes, unless you have single ventricle heart disease. If you have single ventricle heart disease, then yes, we've rerouted blood to a point where it is compatible with life, but it is still not normal.
Yeah.
Okay. And so in that case, I tell parents in their prenatal visits that, if your child, you follow the lead of your child. If your child is good at something, you encourage it. But, you will realize that your child may fall behind in some sports. And in that case, you reroute them to things that they will be good at. And
Smart.
It has nothing to do with congenital heart disease sometimes. Some kids that don't have congenital heart disease are not going to be great football players. Right?
Yeah.
And so, it's very easy to think, oh, this is because my child has a heart defect. But sometimes you just need to accept the fact that this is just not going to happen. And it's okay.
Yeah.
It's okay. Not every child was born to be a football player.
No.
And yes, in this case, this heart disease might affect this child's stamina and ability more than if they didn't have it. But, you may have just had bad luck in the fact that your child is not into sports anyway.
Right.
So I wouldn't put it all on the heart defect.
There's nothing wrong with that.
And there's nothing wrong with that. I was not a sporty person.
Neither was I.
Yeah, I love books and libraries and all the things. And so, it's okay. And I do not have congenital heart disease. But yes, if my parents had dreamt of me being a sporty person, they would be very interested in knowing if this is going to affect the rest of my life.
If my child has a congenital heart defect, are they likely to pass it on to their children?
Mm-hmm. That's a great question, and also one that my patients ask pretty frequently.
Sure.
And the the correct or most accurate answer is I don't know. Okay.
Okay.
Statistically, there is an increased chance of you having a child with a congenital heart defect if you have a congenital heart defect. But that number is very small. If I'm a mother who has congenital heart defect and I'm pregnant, my unborn child has a 5% chance of having a congenital heart defect, which is more than that of the general population, which is 1%.
Okay.
So you can think about it two ways. My child has 5 times the risk of congenital heart defect as any other child. Or I have a 95% chance of having a normal pregnancy with a child with a completely normal heart.
It's the glass full.
Glass half full. So there are both ways of thinking about it. The way I tell them is you have a higher chance of having a child without a heart defect than you do of having a child with a heart defect.
Yeah.
Unless there is a more obvious link, like a specific gene that, is inherited in a certain manner. In that case, I'm able to give them a little bit more of an informed answer as to, some genes have a 50-50 chance of getting passed on, in which case the numbers change a little bit.
Okay. I thought it would be interesting to talk a little bit about the most commonly congenital heart defect known as blue baby. And
Blue baby disease.
I want to say this the right way, tetralogy of Fallot.
Yeah.
Did I do it right?
Yes,
all right.
You did.
Okay.
Perfect. That was absolutely perfect.
Okay.
So you're right. Tetralogy of Fallot is the most well-known disease, out in the general population. There have actually even been movies that have been cast on it. It is, when you think about a child with congenital heart disease, you think about tetralogy of Fallot, because when you see a baby that looks blue, you think that the most common reason this could happen is tetralogy of Fallot. And so whenever a child looks blue, you have to think about what is going on in the heart that could be making the baby blue. And it's usually mixing of blood. It's usually that blue blood that's supposed to stay on the right side and go directly to the lungs, instead makes its way out into the body. And that's why you can see it in your fingers, and you can see it in the mouth. And so in tetralogy of Fallot, what happens is that the wall that separates the bottom two chambers, it doesn't align in a manner that it's supposed to. And so if I were to, if my heart is on this left side, and this is the wall that separates the right and the left side, this wall is going this way. So it's going forward, upwards, and leftwards. And when it does that, now it's created this space for blood to go from the right to the left and out to my body. So there's blue blood in my circulation. And in coming forward, what it's done is it has encroached on my pulmonary valve that would allow blood to go to the lungs. So not only am I allowing blue blood to go to the body, I'm allowing less blue blood to actually be oxygenated in the lungs.
Oh, wow.
So, we call it tetralogy, meaning 4 things, but it's really just the one defect, which is the fact that
that's a big one,
ventricular septum, it's just malaligned. And so it can have several severities. Not every tetralogy of Fallot actually looks or results in a blue baby. Some of them can actually look pink and just act like they have a hole in their heart.
Oh, okay.
And some of them can have varying degrees of pulmonary valve stenosis, and the most severe of which is that valve doesn't form at all, and it's atretic.
Wow.
And that is what we call critical congenital heart disease, because that is the kind of heart disease that you need to know before this baby is born.
Oh.
And you need to make sure that baby has access to immediate cardiac treatment after they're born. And so when we diagnose tetralogy of Fallot, where the pulmonary valve has not formed, we say immediately, come on over. You are going to deliver here. You're going to deliver in Morgantown at WVU Medicine Golisano Children's. And we are going to have a cardiac unit that is waiting for you and ready for you. And we're going to have all the medications and all the expertise ready and available to take care of your child.
So let's talk about that. The expertise, the level of expertise at WVU Medicine, Golisano Children's. Why? I mean, people don't have to leave the state to get excellent care. Can you talk a little bit about the expertise of the team?
Yeah. So we have a great team here. We have people that do general cardiology out in the state. We have people that do advanced imaging, including advanced echo and CTs and MRIs. We have physicians that are trained in intervention. So they'll go in and stent an artery if they need to. They'll go in and balloon a valve if they need to. And then we have our surgeons, who are top of the class with great outcomes and always readily available. They're on call for us 24/7. And so the whole idea of our heart center is to allow everybody in West Virginia to have access to care. And so if we can provide care closer to your home, we will try to do that as much as possible. But if we feel like you need specialized care that requires you to be in a heart center, then we will immediately get you over.
That's
over
the priority.
to Morgantown. Yes, absolutely.
Sure.
But that does not mean that once you come up there, you have to stay there. Once your inpatient treatment has been completed, you may go back to your home and then follow up at a clinic that is closest to you. So you only need to come up when you need, for example, a procedure or a specific test that's only done up here. But a lot of your care, the majority of your care, we try to bring closer to home.
Yeah, makes a big difference.
Yes.
So before we go, I want you to tell me what's the most important thing you want parents to know about congenital heart defects?
Right. I think, when I say that your baby or your child has a heart defect, it is bad news for parents. And a lot of them take it, very hard on themselves. And I want them to know that not every congenital heart disease is bad. Okay. A lot of these heart defects are heart defects that we can take care of. These are heart defects that we can cure or repair. And then every once in a while, we will find something that we can't cure or repair. We will palliate or make it compatible with life, but we won't be able to make the problem go away in its entirety. And so, make sure that you get all the testing that you need. Make sure that you keep your follow-ups if your child has congenital heart disease, and make sure that you ask all the right questions. I want every parent to feel empowered to ask every question that comes into their head, and regardless of how small or meaningless it may feel, if it puts your heart at ease, that is what we're here for. And so if you have the question of, can my child play t-ball when they turn the age of 3 and they still have residual heart defect? Please ask me that. Don't just go do it.
Yeah.
Please just ask me. Ask me. I will tell you yes or no.
Yeah.
And we'll figure it out, and we'll find something that works for you and your family, because we are one team. We are one team. We will work together. I am here for your child, and we will work it out. And we have an excellent team. We have a case manager that really cares for our patients, and we will do everything that you need to do, and we'll make sure that you get there.
Well, thank you so much, Dr. Hoda, for sharing all this information. I think we've put some people at ease, maybe some parents at ease. There's a lot of hope here. But thank you for sharing this with us today.
Absolutely, it was a pleasure being here. Thank you for having me, Mary.
Thank you. All right, so that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on congenital heart defects and other children's conditions, visit WVUkids.com. To find the latest episode of Live Healthy West Virginia, visit our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist, or search WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Hoda and everyone at WVU Medicine, thanks for joining us.